All right. Good evening, everyone. We are all set for the live broadcast stream of today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV, Comcast, and Frontier Government Channels 96 and 6032. It would also be streamed via hpa-tv.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It will also be rebroadcast and made available on the HPA-TV YouTube channel. So officially bringing this meeting to order, let me comment on everyone that is here. First person is Councilman Mictum. Hello, Councilman Mictum. We have Lydia Colon, who is the legislative liaison for my council office. We also have Director Arroyo, Health and Human Service Director. We have Councilwoman Marilyn Rossetti, who is a voting member. We have Attorney Osborne from Corporation Counsel Office. We have Martha Page from Food and Policy, right? Food Policy. We have Violet Haldane from the Advocacy to Legacy Project. We have Devon Chambers. I'm not sure, Devon, which item are you testifying on? Violet, is Devon with you?
Yep, he's with me.
Okay, and is Action Travel with you as well?
Yes, I don't think she'll be speaking though, but she's
okay.
with me.
Well, all right, Action Travel, thanks for joining us. So we'll get started. And so item number 2.1. Okay. Item number 2.1 is Councilman Mictum and Councilwoman Hercules. It's a resolution for a study on the North End grocery store. I believe that this was amended or updated, but Councilman Mictum, if you can let us know what's going on, and the floor is yours, sir.
Thank you, Councilman LeBron. Yeah, the version that's online is the original version. Unfortunately, I had in response to the criticisms or the feedback from last time that this was before this committee, I did draft a new version. So I don't know. I just realized that the new version wasn't online, and I had emailed you and Lydia a little, but it was very shortly before. So I think the only other voting member who's here is Councilwoman Rossetti. I could just email it to her.
No, yeah, I can share it. Would you like me to share it on my screen, Councilman Mictum?
Sure, if you could, because I think as you do that, I'll just explain what the difference is between my first draft and the draft that I'm circulating now.
Here you go. I think it should be in the entire screen. Can everyone see this?
Could you enlarge it a little bit?
Enlarge, yes.
Councilman?
Yeah. All right.
So basically, when I had, and I'll summarize so that you don't really have to read it, but when I had initially proposed this, I said that it was calling on the Department of Development Services simply to contract a consulting firm to do a study of the feasibility of a city-owned and operated grocery store. And the feedback that came from both the director of DDS and others at the first go round was we should study all of the options. We should have a study that looks at all of the options. And so I redrafted this to reflect that it should say, and you can see, I think it's in maybe the first or second resolved, but it says, study the likely cost of a city-owned grocery store, a privately owned grocery store, or a public-private partnership. And really the goal here is we know we have tried to get a public grocery store in the North End for as long as most of us have been alive without success. And so my hope is that we can get a little analysis on what would it take in terms of tax abatements and other incentives to get the private version versus what would it cost us both in terms of upfront setting up cost and ongoing operational cost to operate a publicly owned version or some public-private partnership, just so that we have some really solid numbers on what is this going to cost one way or the other. So that's my proposal. When the director was here, Director of Development Services, I couldn't be here, but I did watch it afterward, and he said that DDS had studied the publicly owned grocery store and determined that it wasn't feasible. I don't think that's actually true, because when I first brought it up to him some months before that, he said, "Oh, we never looked into that. We'll have to look into that." And then he came here and said they'd studied it, and so I emailed him and Mr. Rothschild, and I said, "Please share with me your studies and what you found." And the answer was silence. And I did follow up a few times. So I don't think there's been a comprehensive study of a publicly owned grocery store in Hartford. And so I'm just saying we should study it, because maybe we can solve this problem a different way than we've tried.
Thank you, Councilman Mictum. Was that all, Councilman? Yeah. All right, Councilwoman Rossetti.
Thank you, Mr. Chair. And thank you, Councilman Mictum. A couple of things. As someone who was involved, pre-baseball stadium, when there was going to be a grocery store and ShopRite was the operator, and, all the work that went into that, and the discovery of, different things around groceries that I never knew, and just the area, food desert. I know proximity, people thought it was downtown, but it actually fit well into, with bus lines and others, the food desert area. And certainly we can look into this, and I support this fully, but a lot that I learned out of that was even people who operate grocery stores for a living have a hard time operating grocery stores. So I think a part of it is not to dismiss, let's look at alternatives. And I really support this again, because I really, to this day, think we would have a full service ShopRite grocery store right there, but instead we have a baseball stadium, but that's another whole discussion. So I want to make sure, though, Councilman Mictum, that for the people who continue to work on it, Rex Fowler and oh my God, I can't think of her name right now. People who are continuing to work on it, that we don't not utilize their knowledge and wherewithal to make sure that we don't. And I'm glad, yeah, we need to get Director of Development Services, but let's also get the people who've had feet on the street and been dealing with this and have the knowledge. Don't necessarily, I'm just going to say, depend on them to tell us what are the things. So I know that Rex, and remind me, Martha, what's the name of the group? You're on mute.
Yeah, it's the Community Action Task Force with Denise Holter.
Denise Holter, that's what I was thinking of. So I want to make sure we utilize the knowledge, and maybe so we're, instead of starting from here, we're starting from here, and then maybe go off in some different avenues. But I fully support this. I just want to make sure that, and there's others too, that we work collaboratively. Let's not, and also, no offense, let's not just depend on our city. So, however I can be useful, I would absolutely like to be. So I applaud you in this, but I also want us to make sure we, don't reinvent the wheel, so to speak. Thank you. Thank you, Mr. Chair.
Thank you, Councilwoman Rossetti. Ms. Page?
Yeah, I just want to echo a little bit of what Councilwoman Rossetti had to say. And in addition to utilizing the knowledge, there have been market studies in that area. There's also been groups that have worked on the concept of a co-op. So I'm a big fan of looking at all the alternatives that exist, but let's not start from a blank sheet of paper, because we don't have a blank sheet of paper. There has been a lot that has been looked at. I'm pretty certain in everything that I have seen, both through the commission and also with the work with the Community Action Task Force and the Healthy Hartford Hub, I don't recall ever seeing any sort of study around city ownership of a grocery store. I think that's fraught, but it's worth studying if we're going to look at all alternatives. But let's make sure that we pull together everything that's been done over the last 4 or 5 years, so that if a consultant is going to look at this, that they don't have to start from square one.
Thank you, Ms. Page. Councilman Mictum, just give me 1 second, and I know you have to I'm interested to see what Director Arroyo has learned and how it interplays with the Health and Human Service Office. Do you see the lack of a grocery store impact services director in your work? Sorry to put you on the spot. You don't have to answer,
Can you all hear me? I'm sorry, I'm using
Yeah.
my AirPods. Okay,
Yeah.
I just want to make sure. I've been involved more deeply and then tangentially over my 5 years here with different iterations of the CADF and the work that Martha and others have done. And even the city health department was involved at one time with some funding from Robert Wood Johnson Foundation and some of this work. And so we definitely see, I will say, an impact on our budget. One of our biggest expenses in my budget is our work around the Dollar Ride program. Dollar Ride is providing rides to our seniors, at least, to grocery stores. So we have obviously our only full service grocery store on the south end. We take our seniors there. We take our seniors out of the city in order to access the full service grocery store. And so it is something that we do see as that is needed, at least amongst our population of elderly that do not have vehicles. And we would obviously extend that to a larger population throughout the city. We know that having access to fresh fruits and vegetables and other health needs, and so it's not just a grocery store. I think the beauty of the work that has been done that Martha has referenced is the fact, and that the CADF has really taken a big interest in, is using the grocery store as a mechanism to bring other resources in. And the health department has discussed if this was something that was to come to fruition, and the ability to also have these wraparound services through the Hartford Healthy Hub, that we would be interested in co-locating some services there, at least on a regular basis. So sort of like our WIC program, having our WIC program be there to be able to help our young parents that are accessing our WIC program and things like that. So it's definitely something that we would love to see happen, to have at least a second full service grocery store in the city, because we know that there's definitely a need.
So, Director, Councilman Mickham, I just want, while I have it here, Director, using our seniors as a control group, let me call a thing, right? So we do have Save a Lot on Main Street. There is a Bravos. My grandmother loved Bravos on Garden Street. My grandmother lived on Garden Street. Bravos was on Albany Avenue. I would have to take her from time to time. She loved it. And I'm trying to think. I think that is the only two stores.
There's also Seatown, not necessarily on the north end, but we know that some people from the north end.
Seatown in the south. Seatown. And then you have Key Foods.
Right. And there's Carlos Supermarket on Farmington. And
there's Carlos. And so I guess the question is, right, for the seniors, do they have options, or are we just bringing them there? Like, I want to hear what their voice is. How do they consider those other stores?
So we know that they're going to those stores. We often hear from our seniors, and we haven't, to be upfront and fair about this, we've not done a survey in a while with our seniors. It is something that we have to do again. However, we do listen to our seniors. So at one point, our seniors, we were taking them to Big Y. They told us they didn't want to go to Big Y. In West Hartford, we eliminated that run. And in eliminating that run, we had larger conversations about where those things would be. So currently, like I said, we do the Stop and Shop in Capaco. I think I always say it wrong. We do it in Capaco because we hear from our North End seniors that that's where they find a lot of the West Indian sundries and foods that they want. So we have a run there. We have a run on the South Side to the Stop and Shop there because, again, you get a lot of the Puerto Rican products and Latino products there. And then we also have a run to the Walmart. So you get a little bit of that less
Right,
variety on the food service side,
Right.
but it's also a place where we know our seniors have access to other things that they may need.
right.
And so because they have a large, it's a, you know, what they used to call them super centers.
One-stop shop, yeah.
Yep, they go there and they get their groceries and they get whatever other things they need. We did at one point add key food to that. Then they decided they didn't want key food. So we do listen to them and we try to modify the runs that they're looking for based on that. And so that everyone is aware, we have preset runs that go to each of our senior housing complexes. So they'll have a day a week or a day every other week. I don't recall exactly right now. I think it's a day a week where there'll be a preset run. So we do this senior housing, this senior housing, this senior housing. We drop them off at the Walmart, and that's there. We drop them off at the Stop and Shop. Then we circle back around. But we also have runs where seniors that are not living in senior housing can also get a run as well. So that's also happening. We try not to leave folks out. We understand that not all of our seniors may be income eligible for senior housing or are living in senior housing. And so we try to do that. But we do listen to them as things bubble up and percolate. We try within the best of our ability to meet those needs. And usually we don't want one person asking, we ask for several, you know, that there's
Right.
more than one person asking.
So I just want to introduce Majority Leader TJ Clark has joined us, who's also a voting member. Councilman Mictum, then Councilwoman Rossetti.
Thank you. And I wanted to respond to what Ms. Page and Councilwoman Rossetti had said before, and I have to get off in a few minutes, but I appreciate very much. I mean, one, that any study, anything we do should include Denise, Rex, all the folks who have been doing this work, and also any, you know, reports or substantive, you know, documents that have been generated. And I would just put out there that if that makes sense, I would happily revise this to sort of say specifically, you know, to say that the study should include consultations with community leaders and activists who have worked on this issue in the consideration of prior studies. Maybe I mean, I would hope it would include that anyway, but maybe we be explicit so we're making sure we don't leave anything out.
Agreed. Councilwoman Rossetti.
And through you, Mr. Chair, you know, when we talk, you know, there's also the definitions of a grocery store, you know, it's by square footage. You know, I know we mentioned certainly there are other availability of food products in this city, but, you know, when we were looking at it back before they built the stadium, I'm not going to dwell on it. It was about access to healthy foods, certainly access to diverse foods, but access to foods, you know, more product, more economical. You know, the smaller a place is, more overhead. So you were going to get a bigger bang for your buck. And this ShopRite operator, they're all owned by, you know, they're all owned by somebody, and they all have to agree to. It was really interesting to know how they did it, but we also learned a lot about the differences and how much more people were spending by certainly, I'm not dismissing all these local markets because they do serve a purpose, but if we could have something to the size that we're talking about, it is about the finances. It is about how far your dollar would stretch. It is about a healthy product. It is about having access. So I applaud this, and we can either add Councilman Mitchum a friendly amendment. We don't have to reinvent the wheel again. I just want to make sure that we don't leave that part out. I want to build from that, and then we can take it from there. Thank you, Mr. Chair.
Thank you, Councilwoman Rossetti. I just, since we have a lot of agenda items and Councilman Mictum, you have to leave. I think we all in agreement that our folks, you know, having a full service grocery store, if we're using that language, right? We have one in the South End, and having one in the North End would make sense. I think everyone agrees on that. And then having access to healthy foods.
One more thing, Mr. Chair.
Yes.
Oh, and then I'll stop. It's all coming back to me now. You know, and also depending on what part of the, you know, the swath of the food desert, there was funding available. That was the other thing. Where it would be built, you would have access to capital. So keep that in mind also. It's not just where you put it, but you want to have the dollars to be able to also build it. Now I'll stop.
Yeah, I think, and so you're right in terms of, and that's part of, you know, all of these things. I think trying to solve it in a bubble I think the theme of what I've heard from everyone is that there's so many different factors. The one thing that I would say is that I think where are we aligned? Well, we're all aligned on that we need access. We need access to a full service grocery store. We need access to healthy food and healthy food options. And I think our seniors are telling us with the dollarized system. The other thing too I want to acknowledge is the budget piece. Oftentimes or not just anyone, the larger system, right? Rather it be a municipality, the state, nonprofits, we do these consulting things, or we hire consultants to do studies. We get them and then we put them on a shelf. And then they collect dust and then nothing happens with them. I think that we have an opportunity to look upon the past and the wisdom that has been done in the past and see if there's any gaps in that, and then build upon that, and then see, what do we have in the bank, in the toolkit, to see what it is that, we would need. So that way we're not solely reliant on a department, and probably in particular one person or a handful of people. Why not bring more people into the conversation? So the question I have for you, Ms. Page, is this Community Action Task Force, the concept of a grocery store in the North End, where is that on your goals? Is that part of your bullet points? Where does that fall?
It's essentially the centerpiece, but Director Arroyo pointed out something that's important. It isn't just the grocery store. It is grocery store plus health promoting services, grocery store plus the ability to enable residents to take care of their own health through not only access to healthy food, but I think that the concept that's been floated with the planning and zoning folks is like a health district, if you will.
Mm-hmm.
So the grocery store.
I'm so sorry. I have to leave.
You gotta leave?
I gotta go, but I thank you all. And I'm sorry that I'm stepping out, and I'm sorry to interrupt you, Ms. Page.
No problem, Councilman McDonough. We'll follow up tomorrow. I promise. It won't go away.
So so it is. So the grocery store remains the centerpiece, and it remains the centerpiece as much for the fact that a full service grocery store is needed, and there is data and studies that demonstrate that, but that it is a matter of community fairness, that folks shouldn't have to go all over creation in order to get good groceries. So it serves multiple purposes, but very much a grocery store is a part of that mix.
Right. Majority Leader Clark.
Thank you, through you, Mr. Chair. Just for a point of clarification, what resolution are we discussing?
Oh, so we're discussing Councilman McDonough and Councilwoman Hercules, the resolution for a study on the North End grocery store.
Okay, that's what I thought. So I know this committee and council already passed the resolution regarding identifying a grocery store location in the North End that I had authored and many of our colleagues had signed on to. I think we are past that point of doing a study because I know Ms. Page and some others from UConn and other institution partners have been discussing this for the past 10 years. I think we are really at the point where we just need to work with development services and others, other state partners, to really identify a location and means for funding. Because my conversations with individuals that are in the grocery store business is the fact that the way that grocery stores are erected and run have changed, and they are very much concerned regarding the overhead. And so the socioeconomic status of the neighborhood makes sense. And also too, with the looking at it through another lens as to what more can it be than just a full service grocery store. So it can't be, as I'm told by experts, it can't be the size of a Stop and Shop that we have in Capaco or on New Park Avenue. It could be you have to think about it through the lens of maybe the size of an Aldi's, because of the fact that now with the new state-of-the-art systems for Instacart and other food delivery systems that the grocery store may do, those are some certain concepts that need to be discussed. I think that there are locations that we have discussed with development services and also through CRDA that can be developed. The problem is, the bottom line is funding. And so that funding has to come from the city of Hartford. So here's the dynamic that we should be really discussing. What funds do we have within the city's coffers, and what additional means can we get from the state or federal government to help to alleviate the food desert that we have in North Hartford?
So, Majority Leader, are you saying that okay, so I think if I'm hearing you correctly, you're saying like we're beyond a study, like we need to just a call to action, if you will.
That is correct. We are beyond the study.
So I definitely agree with you on that. And so I think the question would be, how do we come together and leverage that? I think what also needs to, Majority Leader, and just a question for you. I think from when I talk to residents and talk to community partners, and it sounds to me that you're much more versed in speaking to the business folks and understanding the landscape of what a grocery store looks like today from what it looks like, maybe a decade ago. I think, but what the community is asking for is some level of transparency that there's efforts being made. And so what I don't want to do, or I don't think would, I'm gonna use this word, Marilyn, don't Councilwoman Rossetti, don't get at me, behoove us to the Majority Leader, I know you're gonna laugh, but like to do something where we can provide transparency with those conversations, instead of saying, okay, it's a call to action on our council side, let's go behind closed doors and force the issue. So Majority Leader, what do you think that the next step would be, or what would your ideas be on not only executing and calling to action this item, but also providing the transparency that the community craves?
Through you, Mr. Chair, thank you for that question. I have no means of participating, and I know people hate the word task force, but if there needs to be a task force that needs to be convened or community meetings, I have no problem sitting on that and discussing this in the public, because it's already known that I've been trying to champion, help this effort regarding alleviating a food desert in the North End. And I want to be clear, I don't want a grocery store, this is me talking, I don't want a grocery store located in a downtown area where the folks that have to drive down Albany Avenue or Main Street have to access. I know that that's been one of those parcels within Don't Know has been discussed. I fundamentally believe a grocery store needs to be strategically placed in a neighborhood where our residents that we serve have access to that by means of, whether it's their own transportation or public transportation. Because as you stated before when I got on, there is a full service grocery store located in the South End. And I would say there too. There's a Walmart and Walmart Plaza, as well as the Stop and Shop. In North Hartford, we don't have those means of accessibility to those full-size grocery stores. We got to either go to West Hartford, yes, Bloomfield, or Windsor.
Yeah.
And so that's where my position is. It needs to be placed in a neighborhood that is in North Hartford. And again, I have no problems calling a public meeting together to discuss ideas, to see what the community may want. We definitely can receive input from those that have been working on this project over the years, especially our partners at UConn, to really say this is a location that we should be considering, or the type of foods as well.
Right. So Councilor Rossetti, I'll get to you in a second. So just 1 second, Ms. Page, do you think, since you have a task force, again, it's not focused on this specific topic being part of a larger topic. Do you think that this would be something that we can put as an agenda item and give it some leverage and or energy and or transparency that the community craves with the support of the Health and Human Service Committee?
I don't want to speak on behalf, I mean, I'm not the chair of the group.
Okay.
I'm just a member, but in that capacity, I would certainly think that that would be worth having the conversation with Denise, particularly. Denise Holter chairs the group. So I absolutely think that that the group would want to be part of any conversation about it, because they have been in conversation on this for a really long time. I also think that the other perspective is that this is something that the Food Policy Commission could get behind,
Right.
And help support, because this is obviously right in the wheelhouse of that commission's work as well.
Okay. Thank you, Ms. Page. Councilwoman Rossetti?
Through you, Mr. Chair, I wasn't suggesting, where something would be located. And again, it was some time ago when I worked on this, before the stadium was built. I don't know if I mentioned that, but I do know, and that may have changed also. Majority Leader Clark knows, I'm sure, much more than this, that the area that's designated, geographically designated food desert, there was funding tied to that. I'm sure it's changed. We've had a pandemic since then, but certainly I wasn't suggesting, I was just talking about where that spot was, but absolutely it needs to go where need is best. And I'm going to stop.
Okay.
Thank you.
Thank you, Councilwoman Rossetti. I don't, I think when you were talking historically about the past processes, I didn't think the inference was for that, but thank you for clarifying that. I appreciate it. Okay, so here's what I think. I think what we should do with the support of the Health and Human Service Committee is to have a conversation. Because I know Councilman Clark, I know the word that no one wants to hear is a task force, right? And so if we have something built already, how do we bake it in, get the support and leverage that we need? And we're facing a critical juncture right now with the budget season coming fast upon us. So I think we have a great opportunity here to really capitalize on this open window. And so on the council side, we, one of our major, or some would argue the most important influence that we have is on the budget. So Ms. Page, the chair's name is Deborah?
No, it's Denise Holter.
Denise Holter. So Lydia, if you can just write a note. What I would say, Councilwoman Rossetti and Majority Leader Clark, would you all be interested in having a meeting this week with Denise Holter to talk about if it's an opportunity to bake in a task force to the items with the support of council? Would you guys be willing to do that?
I have no problem to you, or even making this as a suggestion, making it a subcommittee of the Health and Human Services, or maybe an ad hoc committee of the Health.
An ad hoc committee. All right, great. So we'll follow up, Lydia. We'll follow up with the chairs of the Health and Human Service Committee and potentially Denise Holter. So with that being said, for the record, I'll take a motion to postpone this. Well, excuse me, I'll take a motion. I'll take a motion on item 2.1.
To you, Mr. Chair, I make a motion that we postpone this item until the ad hoc committee has convened.
I second.
All right. I second. All right, we have a motion on the table and second it. That we postpone this item until an ad hoc task force has convened. All in favor, say aye.
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 Aye. Let the record reflect. Thank you for this item, and thank you, Majority Leader Clark, for coming in and discussing and moving it, the call to action. All right, great. So we'll move forward to item 2.2. Mayor Bronin with the company resolution for the city to accept gift cards donations totaling 35,000 from DoorDash's community credits program. And who's here to talk on this item? Director, the floor is yours.
Very good. Good evening, everyone again. So this particular resolution and donation of credits essentially comes out of the White House conference that they had on fighting hunger and hunger and nutrition that they had in the fall. And essentially DoorDash was a part of this, and they came to the table with the Biden administration to basically put their money where their mouth is and expand some of the outreach they have been doing. So one of the things that they came up with was focusing on mid-sized cities, which don't often get the attention of rural areas or big cities as it relates to hunger, and are providing these credits. These credits are essentially $25 worth of items that you can order via a code through DoorDash. And so we would be receiving $17,500 year one, which is this year, and $17,500 in credits year two to be used in $25 increments. They have allowed us to design how we would use these credits. And so HHS with an internal group came together and put some parameters about how we would use these, how many we would give out at a time, and use them to really fulfill gaps that we don't have or are unable to as a city agency. So when we relocate individuals, oftentimes we're relocating them to a hotel that doesn't have a kitchen or anything like that. So they have to use either fast food or other services. And so DoorDash will allow, we can provide them with 1 or 2 credits, which would be $25 to $50 to at least assist them in this process of purchasing food. It also can be used for personal hygiene products, infant formula and things like that, because it's not just grocery stores or it's not just restaurants, it's also grocery stores, it's also convenience stores like your CVS or Rite Aid or anything like that. And so that is our plan moving forward, is looking at our relocation clients that may need additional assistance, if we're opening emergency shelters to be able to provide food, if we're working with WIC recipients or new WIC recipients who may have fallen off the rolls and we need 24 hours to get them back on, we can provide them with the $25 credit to be able to purchase infant formula at one of our local establishments that works with DoorDash. And then working together as well, we did speak with and will partner with our community engagement team, who often will get phone calls from time to time or about situations that arise, that we can also provide those credits. And so that's essentially it. It's a one-time donation over 2 years for us to be able to use.
Councilman have to step away.
Okay. Any questions from the other council members?
I do have a question. Thank you, Madam Director. Maybe you did say this and I missed this. How would they be able to gain the gift card if they don't have a phone? Because I know many of the gift cards are now accessible via their smartphone. So what if they don't have a smartphone?
It's a code. That's going to be challenging. You do have to have the app. You do have to be able to access it. And what we have found oftentimes is that most people will have access to a phone or someone's phone. If you recall, during the pandemic, 4CT had partnered with the United Way to provide gift cards. That was also a numerical number that needed to be used online. So we have some experience with that. But it's not a physical gift card. It is all electronic, unfortunately. But we would most definitely work with our partners on that. So if we have someone coming into the office and we're having that conversation, then we would obviously work with them to establish that on their phones.
Okay, thank you.
I am back. Councilwoman Rossetti, any questions? No? All right. The chair will entertain a motion to The chair will entertain a motion for item 2.2.
Motion for favorable recommendation back to council.
All right, we have a second. All right, all in favor, say aye.
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 I say none opposed. Motion has been passed. All right, Director, I'm going to inject item 2.5 here. We have advocacy to legacy. We got some young folks on here who have to get to their homework. So I'm going to move the agenda a little bit. And so for advocacy to legacy, we have Ms. Violet Haldane. If you could please explain a little bit about the group and the work that you've been doing with the young folks in our community. And the floor is yours.
Thank you. Name is Violet Haldane, and the organization is called Advocacy Legacy. And our mission is to educate individuals, families, and communities how to advocate for themselves in order to change lives. The students that are with me today, there are 4 on the call who will be speaking. We've been engaged in doing tobacco-related work for several years. Some of these students worked on the Tobacco 21 legislation. We worked with the city and some other community organizations on that legislation. But essentially, we teach young people how the government works, how to bring forth change. And one of the ways is through advocating for themselves on topics that they feel are important to them and trying to change laws and policies. So this is a continuation of the tobacco work that we've been working on, I think, for over 4 years. And the students are going to speak. They do their research. They choose a position. They write their position paper, and then they come and present it. And so I don't know who wants to go first, and they will explain to you what they are advocating for on this go around. So are there any volunteers? We have Devon Chambers, Akeelia James, Akeem James, and Omar Vinson. Well, I'm going to go with Devon because he was the first one on the phone. Devon, can you unmute?
Hello, my name is Devon. I can't really get my camera going. I'm on my laptop right now and I just realized it doesn't work. But I have my position paper here, right here, and I'm ready to go.
Go ahead.
Okay, so my name is Devon Chambers. I'm a senior in high school and I'm an advocate for my community. As of today, there is no policy or law that forbids the selling of tobacco or nicotine products in close proximity of schools. However, there is currently a policy that forbids the selling of alcohol within 500 feet of schools and rec centers. I believe that the policy in place for alcohol should also come into effect for tobacco and nicotine products. This is important for the health of the community. Did somebody talk? Or can I keep going? Okay.
Keep going.
This is important for the health of the community. When kids walk home from school, they go into local gas stations, corner stores, or bodegas, and they see advertisement of tobacco and nicotine products. When you first walk into the stores, there's the tobacco and nicotine products are right next to the candy and all the other things that the children go into the stores for. This is specifically important to me because when I worked for BHCA during their summer youth employment program, I worked closely with children and saw some of the children that I worked with walking homes with the tobacco and nicotine products in their hands. Not only is that unsafe, but it's most of all unhealthy for their bodies. I believe that limiting or terminating the selling of tobacco and nicotine products in close proximity of schools will not only benefit the children, but also the health of the community, as well as potentially breaking the unhealthy habit of smoking in the community. We are here today to ask for your support to enact this proximity policy for the better of Hartford as a whole.
Thank you. I'll go on to Akeelia.
Hello, everyone. Hello, everyone. My name is Akeelia James. I'm 18 years old. I am a senior at Achievement First Hartford High School, and I'm here to speak about our tobacco proximity policy. This policy is to limit the sale or purchase of tobacco products 500 feet from schools. This is important to me because, as a person of color and whose community was and is still being targeted by tobacco products, it would be beneficial for the new generation of Black and brown kids to not have these products in their everyday life. By seeing them as they go to school or after school programs, kids are at a very vulnerable stage in their life where they are easily influenced and have a high chance of using tobacco products, such as vapes and things like that. If they begin to use tobacco products, they are prone to lung disease and brain problems. Tobacco products are also one of the major causes of death in the black and brown communities because it causes heart disease and cancer and stroke. Having this policy put in place will decrease the possibility of kids purchasing tobacco products because it will be out of their reach. I am in favor of this policy, which will limit the sales or purchases of tobacco products 500 feet from schools, and I hope you will support it.
Thank you. Akeem?
Good night. My name is Akeem James. I'm a high school student at Schumer First Hartford High School. My reasoning for testifying today is to advocate for tobacco products not to be sold within a 500 feet radius from schools. This policy currently applies to alcohol, but not to tobacco products. So when I was doing my research, I used some information from the CDC. And according to the CDC, the Centers of Disease Control and Prevention, tobacco product usually starts during adolescence. Um, and they like use some data in 2022, and it said for every 100 middle school students and one of every 6 high school students, they have reported current use of tobacco products. Creating a 500 feet distance between schools and tobacco product selling stores could possibly decrease those statistics of young people smoking. So the overall idea of this policy is to limit adolescent access to tobacco products and making tobacco products less visible and accessible could possibly remove the the presence of the product from young people's lives. Um, one of the things when I was researching, one of the things like I was realizing was that the presence of tobacco products is it has the same impact as someone who's using it. Like you don't have to use it. Like the presence is like big. It's like a pretty and like in my community, tobacco products are like dominant. Like you see it everywhere on the ground in stores. Personally, going to school, I would like always smell the tobacco products or see it on the ground. And I never developed the curiosity to try the product. That's just me. But for like other young people, that may be different. I'm in favor of creating a policy that limits the sale of tobacco products within a 500 feet radius of schools. And we are asking for your support to push our policy.
Thank you, Akeem. Omar? Are you going to
My
speak?
name is Omar. I'm 17 and a junior in high school. Today, I'm here with my program, Advocacy to Legacy, and we're here to advocate for a change in tobacco laws. To be more specific, we would like to adopt a policy that alcohol already has, which is to be 500 feet away from schools. This project is very important to me because it has greatly impacted and depreciated my community in many ways. One specific way is the advertising that big tobacco companies do, which is very appealing to the eye, especially young kids, children who come out of school every day and see the tobacco products right next to the candies and toys they would buy in the stores, gas stations, and bodegas. Big tobacco companies put their vapes, e-cigs, and many other products on shelves right in front of you as soon as you walk into the store. And as you're checking out with your products leaving, they're right in front and behind the store curtain next to all candies and toys that others and other products that attract young children, especially in this new generation we live amongst. The American Lung Association states that smoking tobacco, vapes, and e-cigs can cause black lung disease, otherwise known as coal dust disease. This is very bad for my community because it not only impacts our parents and grandparents, but it's getting into the younger generation's mind.
Okay, so that's 4 of the students that were able to join us this evening. Our ultimate goal is to reduce youth smoking. In Connecticut, the high school tobacco use rate is 28.7%, and smoking costs the state over $2 billion a year and over 4,900 lives. Youth are particularly vulnerable to peer pressure, and tobacco companies use strategies to get the users hooked early, particularly in packaging, marketing, and location in stores. Nearly 9 in 10 cigarette smokers had their first cigarette by age 18. And I know that 21 is the legal age in Connecticut to purchase it, but students do have access. Retailers are disproportionately located in low-income communities and communities of color. And research shows that restricting retailers from locating near schools can reduce income and race-based disparities in racial retail density. So our ask is that tobacco, nicotine products, which includes e-cigarettes, cigarillos, etc., not be able to be sold within 500 feet of schools. We came up with the 500 feet number because we've discovered that in the state of Connecticut, there is no legislation anywhere that says where you cannot sell cigarettes near schools, but there is regulation for alcohol. The distance varies by town. In Connecticut, the distance is 500 feet. In Bloomfield, it's 1,000 feet. But we are requesting that we have the 500 feet distance in Hartford, as we feel it would be easier to monitor and implement, since we already do it for alcohol. We did try to look at how many stores would be impacted, and we do want the stores to be grandfathered that currently sell these products within a 500 feet limit. And right now, we think there are only 2, Global Academy on Edward Street, and I guess it depends on if the 500 feet starts at the school or if it starts at the end, because there's a football field that goes to Albany Avenue. If it ends at the football field, the stores across the street sell tobacco and the gas station sells cigarettes. But if it's where the school is, they may not be impacted. And the other school that would be impacted at some point would be, I think it's called Parkville, up on Park Street. So maybe the temporary Buckley School. There's a temporary location in Buckley, and I couldn't determine if that was within 500 feet or not. But in looking, throughout the city, we think those are the only schools that at some point would be impacted. And as we're saying, the 500 feet, if a store currently sells the products, they would be grandfathered. But going forward, new owners, et cetera, we would hope that they would not be able to sell the product. So we're open for questions.
Yes, so Ms. Haldane, I want to thank you for your continued work and a wonderful presentation by all of the scholars, the young scholars. They did a fabulous job. It's amazing. But Majority Leader Clark has a question or his hand raised.
Yeah, thank you, Mr. Chair, through you and Ms. Haldane. It's always a pleasure to see you and hear the great work that the Advocacy to Legacy program is doing. I remember when you had me come do a presentation before the kids, and it was a very enlightening experience. My question on your policy recommendation.
Yes.
Are these for new establishments Or is it, would this policy recommendation restrict those shops that are selling cigarettes, restrict them from selling it moving forward?
It's for new establishments. If you're grandfathered, you can continue selling, unless the store changes ownership. Then if it changes ownership, you would not. So existing stores would be grandfathered.
Okay.
Locations would be grandfathered.
Okay, that was going to be my follow-up question, just so that I was clear. Thank you for that clarification. Could you do me a small favor?
Yes.
Can you email the policy recommendations to us? Because I would like to read them again in a little bit more detail.
Yes.
Thank you.
Okay. Thank you.
Councilman Rossetti, any comments?
No, I absolutely agree with it, but I also want to thank the folks who spoke tonight, because it really is important, and I hope you continue to speak out on this and other things, and we welcome you at the committee. Thank you.
Yes, and I just want to say, although they didn't show their camera, I did visit them, and they are students, because they presented like college adults.
I was, through you, Mr. Chair, I wasn't going to ask for identification, but yes, very, very mature and very professional. But I think that just speaks to commitment and Ms. Haldane leadership. So thank you.
Yes. So following Majority Leader Clark was reading my mind, and we're definitely going to follow up with policy recommendations. And so we'll definitely have those emailed to us, Ms. Haldane. So Majority Leader Clark.
No, I'm sorry. I forgot to roll my hand.
Oh, okay. All right.
But I would like to make a motion if it's
yes, absolutely.
I'd like to make a motion that we accept these policy recommendations for consideration of a new ordinance within the Hartford Municipal Code.
Second.
All right. All in favor? Say aye.
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 Aye. Aye. Motion approved. We'll be following up with you, Ms. Haldane. Wonderful job to yourself and the students here. We'll definitely follow up.
We have great role models to follow. And one of my students says he's going to be mayor of Hartford one day. So I'm just putting everyone on notice.
Oh, I mean, listen, he could write, if he puts his name in, I'll drop out.
Thank you. Thank you.
So, all right, thank you all, and I think you guys got homework tonight. So,
thank you for your time.
Have
a wonderful night.
Yeah, you guys are welcome to stay.
Have a good night.
Yes, have a good night.
Have a beautiful night.
Have a good night. Thank you, Nick.
All right, so we'll move on to item 2.3 on the agenda. It's Mayor Bronin with a company resolution to accept a $15,000 $983 grant and state ARPA funding from the Connecticut Department of Aging and Disability Service. I assume that's you, Director Arroyo?
Yes, sir, that is me. So that is additional funding that became available through our NCAA agency, the National our Area Agency on Aging. And so we apply to them every year for funding for several of our programs. You'll be seeing some resolutions for that. I think not in your next meeting, and not in your next council meeting, but the following. And this was additional funding that they had for us to apply for, additional ARPA dollars, and we applied for and received this funding, and it's essentially to cover the increased food costs that our centers have been seeing. And so this money is to ensure that there's sufficient funding to last for the entire program year for our program. And just, the elderly nutrition program is the program, I always forget, just so that everyone knows, our elderly nutrition program is the program that is run through our North End Senior Center and our South End Senior Center that provides meals. They're not free meals, but provides meals to our residents who are part of the senior center for a small fee. And usually that fee is anywhere from $2 to $3.
All right, I'll open it up to the floor.
No questions. Just nice to see Director Arroyo.
Majority Leader Clark, any questions?
No question, sir.
All right, the chair entertain a motion.
Motion for favorable recommendation back to council.
Second,
All right, we have a motion on the table that's been properly second. All in favor, say aye.
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 All right. Let the record reflect 2.3 has been sent back favorably to council. All right, so item 2.4, update on Department of Health and Human Service. So let me just preface this in that during our entire time as members of the Health and Human Service Committee, we have been mired in the pandemic, COVID, and all its variations, Omicron and all the other crons. And Director Arroyo has been leading us in those efforts, along with everyone here in the committee, through the ebbs and flows, unfortunately, of what the pandemic meant for the city services. A month ago, the President of the United States issued or stated that he was going to be ending the executive order regarding COVID. And so that has many implications. Really at a high level, what folks in the community have been speaking on is on benefits, state benefits, but there's also ramifications with testing, medical coverage, and the likes. And so in prompting Director Arroyo for today's presentation, I wanted the director to talk about I don't know if I'm using the right language, the ending of COVID, or there's probably a more proper term that you will inform us on, but the ending of this executive order as it relates to COVID and how the city is preparing for, in the Health and Human Service Department specifically, for this ending of the executive order. So Director, thank you again for attending, and the floor is yours.
Great, thank you. So the ending of the executive order by the Biden administration is essentially an acknowledgement that we're moving from the pandemic phase of COVID to what's called the endemic phase of COVID, which means we have a disease that's here to stay. It's not going to go away, and we essentially have to learn how to live with it. Vaccines were very instrumental in helping us get to this phase, as was the fact that as we were seeing the new variants come out, they seemed to be less virulent, so meaning they cause less disease. Now that's certainly not true for many of our elderly. Our elderly are still very much at risk, which is why vaccination and boosters are critically important for anyone, because you just don't know what COVID can do, but especially for our elderly population. And so the state continues to work very closely with our nursing homes. We continue to do a lot of work in working with our senior housing and other partners to ensure that we continually have access to the COVID vaccine for our elderly population. But as we move to the endemic phase and the learning to live with it phase, a lot of the things that we had as benefits are now going to be absorbed. So I'm going to talk specifically first about the COVID related benefits as it related to vaccines, treatment, and testing first. And then I'll talk a little bit about some of the other impacts that we are going to see or potentially see in the state. So it is, pardon me, I wrote notes because it is, it's dependent on what your insurance status is, right? So I think the biggest thing to know is a lot of things that were free, whether you were insured or uninsured, will no longer be free for the uninsured. And so that's obviously something that we're concerned about. What does that mean if someone's really sick and does really need to go to the hospital? Are they going to not go because now there's this fear of a bill, right? So testing will not be free, vaccines will not be free, treatment will not be free. So there's like sort of that piece of the puzzle. That's where we, at least on the vaccine side and on the testing side at the city, are trying to become a safety net provider around those issues. And we also have other partners in the community, obviously, that could be safety net providers. Our federally codified community health centers could do things at not no cost, but very reduced cost based on sliding income scales. So those options will remain. they'll just revert back to what they've done in the past, which is have the sliding fee scale for, you know, the vaccines, or if they're doing testing and things that way, things like that. Again, you know, each federally qualified community health center may be different if they're running the lab, or if the lab is being run by an outside provider in their facility. Those things will all be different. But for our uninsured, that's going to be the biggest sort of impact that we're going to see. As a municipality and as a state, we're lucky we don't have very high levels of uninsured population, but we also do know that our population that is the most uninsured is our Latino population overall in the state, and that would track with the city. So we'll be looking to see what we can do in ensuring that there's access for all members of the community as needed. So to that end, what have we done? We are waiting to hear. Well, one thing we've done is we have purchased rapid PCR testing machines. So we did that with state funding. It was funding from the federal government that came to the state and then was allocated to us based on a number of factors, including our poverty rate, the impact of COVID on our community, and things like that. So the city is now in possession of 3 rapid PCR testing machines. They can also test for flu. And so we'll be we're establishing and creating, our team was just trained on them recently, and we're establishing and creating some protocols to be able to communicate that to our community and how that would work. And so, you know, as we're looking also as a clinic to start doing insurance billing, which we used to do in the past, that could help us be able to cover some of the costs related to the testing, because there's a contract at this point in time. That contract is being covered by state funding that we have for this purpose, and we expect that to continue through 2024 and potentially into 2025. So we'll be looking at that. We're also, so that's one thing. As it relates to vaccines, none of the funding sources that we have allow us to purchase vaccines. So that's going to be that's something that we're currently looking at. But we have the ability to place an order before the end of May, and that's something that, or before the emergency order ends, and possibly beyond that, because we do know that there's still a supply that the federal government has of vaccine. And so we can continue to order vaccine for free until that supply runs out. We don't know what that will be or when that will be, but we are looking at doing that. We're also waiting to hear back if this is going to be covered under there's talk of doing like the vaccine for children program, potentially a vaccine for adult program, which would mean that the vaccine is free and there's just an administrative cost. So how much it costs for us to put it in your arm, to pay the person to put it in your arm. So we're examining that, but that is a big gap as it relates to the purchase of the vaccine. So testing, we're looking to cover. We have the 3 vaccines. We're going to be working on establishing a system for that. Vaccines, we're thinking through at least doing an order that can potentially get us through the end of the year, since the vaccines in deep freezer or in refrigeration can last a certain amount of time. So then you'll be able to do that. But again, our numbers of uninsured are, relatively speaking, to other folks because of their expansion of the ACA, our exchange, the fact that we've also expanded Husky to individuals under the age of 12 and under. So we have some options there to be able to cover a lot of our folks that are uninsured through other options. Now, as it relates to this looking at vaccines, individuals that are on private insurance, it should continue to stay free, the vaccine, as long as they're in network. That's the expectation. For Medicaid, for anyone on Medicare, Medicaid, or an ACA plan, so you purchase insurance off of the exchange, not from your provider, it's not from your employer, they should continue to remain free. As it relates to testing, I think the biggest change you're going to see is access to free testing and access to free at-home test kits. So currently, you're able to order up to 8 tests per person per household on your insurance plan, whether you have private insurance or you have Medicare, Medicaid, or an ACA plan. And if you're uninsured, you're able to access kits through the online program that the Biden administration set up. And those kits are still available, and we're encouraging people to order kits as well because they're still available to do. So the at-home testing will be limited. What we're hearing, at least on the Medicaid side, at-home testing kits will be covered until 2024, so that will go beyond, and we do have a sizable population that's covered by Medicaid here in the city. It won't be covered by private insurance, and on Medicare, it also won't be covered, but Medicare Advantage plans may be able to pick that up. So we're waiting to see how some of this plays out. And then essentially, lab tests would have to be ordered by a physician. Like currently we can go to Quest and just go online to the program that state has, go in, get a free PCR test, and that's covered. That's also going to change. So some of this is a little bit wait and see, but these are some of the impacts that we're seeing. And then the biggest thing is treatment. So the government purchased Paxlovid, they purchased the monoclonal antibodies, they provided them, and that was free. We weren't charged. So if you received that, you weren't charged. You might have been charged for the office visit, but you weren't charged for the actual medication. And so that will remain the same until the supply that currently exists runs out. We don't know when that'll run out, but at least on the Paxlovid, we're hearing until the middle of the year. I'm sorry, I have children in the background. Can you please give me a minute? Some of you can read lips. I just said I need you, both of you, to stop, nothing else. So again, we're waiting to see. And then on the monoclonal antibodies, not so much of an impact, simply because what we have found is the current set of monoclonal antibodies that we have were not effective against the Omicron. And so that had been removed in many cases. But again, that was free. And even if you were uninsured, there was access to costs being covered by the federal government that are not going to be covered anymore as a result of this. So that's the big picture as it relates to vaccines, testing, and treatment. It's a little bit of a mixed bag, and what that impact will actually be on us is depending, Medicare people, if they're dual eligibles and they have Medicaid, they can get it through there, which we have a large amount of that in the city. If they're not dual eligibles, will Medicare Advantage plan cover that? And then on Medicaid, they're good until 2024. And then I'm sure there'll probably be some things that'll happen there. Other things that will have a big impact, I think most folks know that during the pandemic, the recertification for eligibility for Medicaid was suspended, which was a huge thing. So if you recall, you had to, I can't remember, I think it's twice a year, you had to submit your information to make sure that you were still eligible for Medicaid. And that was suspended during the pandemic. That's coming back. And so states now have 14 months. That process is already starting. Now have 14 months to recertify everyone on their rolls. That doesn't mean that everyone that has access is going to lose access. And if you recall, there was also an expansion of Medicaid in certain instances as well. That doesn't mean that everyone that had it is going to lose it, because they may be eligible for other programs now. And so that process will start. And as you know, in Connecticut, I believe we have like one-stop shop. You apply and you can see that you're eligible for all programs, rather than doing all these little tiny applications to figure things out. And so as folks go through that process, the goal is that they will find if they're eligible for another plan or something else that they can then roll over into. But I do suspect that some folks may fall off, and they can fall off potentially because they now have jobs that are paying them more money, and they have access to other means to do that. And then the last one is, and again, this is in terms of the impact that people may feel, is obviously the food stamps. So the pandemic-related increases in food stamps have been phased out. So we're in the last batch of 33 states that hadn't yet phased it out. And so in February, the last pandemic-related distribution of SNAP benefits is now gone. And so just for context, what we're seeing here in Connecticut from national groups that have done a analysis of what that means to Connecticut, just pulling it up. The state of Connecticut is going to lose $34 million of federal funds per month. So starting this month, $34 million less. We know that it's 219,686 households, more than that. So let's say, about 220,000 households in the state are affected. And on average, again, this is the average, each SNAP participant will lose $82 a month. And the biggest impact is really going to be felt by our elderly population. So the minimum benefit that people can have was $23 a month. That increased with this pandemic benefit. So it went from $281, so they were getting $256 additional dollars to $23. So our elderly population is going to have a huge impact. So that is obviously one thing that we are going to keep an eye on. What we're hearing, or what I've read from other states that have ended it prior to this. So one place was Atlanta. The Atlanta Food Bank is saying that the number of people coming to the food banks that they're serving is as high as it was during the height of the pandemic. So that's the impact that they're feeling right now. And so I have not heard anything from any of the food banks currently, but I do know the CEO had been on the news talking about this and the expected increase that they could potentially be seeing. We've not had phone calls at the office at this point in time. Maybe folks haven't necessarily really realized that, because the disbursement was my understanding is that disbursement happened in 2 waves. So you had your first normal SNAP disbursement, and then a second one came in the middle of the month. When that second one doesn't hit in the middle of this month, that might be something that we start hearing about. But at this point, it's not something that we've heard. I think some other things that insulate us a tiny bit is, unlike other municipalities, we have community eligibility for free and reduced school lunch. So all of our children are able to access free lunch, unlike other municipalities. So that strain for families that are losing some of these EBT benefits, the SNAP benefits, was being even more painfully felt because their children were not having free lunch either. That's not something that is in the city, because we have community eligibility. So that is something that is a little bit of a buffer for us. But again, the full impact remains to be seen. And then lastly, there are a lot of other sort of arcane things that happen in the federal government that are affected by this, that wouldn't affect our daily lives really. Just how government agencies are able to work together, some regulations that were modified as a result of this. So for example, the big, if you think about the big thing is the emergency use authorizations, that process will go back to its normal process and things like that. So there'll be other things that happen behind the scenes that are affected by this, but are not things that we would feel an impact of. What I highlighted were the things that we would most likely see or feel an impact of, either as an individual or as a municipality.
Wow, amazing, amazing. Thank you for the update. And it seems that, I know with you at the helm that we are bracing for whatever potential impact, and it seems that we have an understanding. Let me open it up. Let me open up the floor to my council colleagues. Councilwoman Rossetti.
First of all, thank you, Director Arroyo. Thank you, Mr. Chair. I can honestly, clearly remember sitting in City Hall in February of 2020 at a probably first or second Health and Human Services Committee meeting. Was it the first one?
When I said this isn't going to be a big deal, we're fine.
Yeah, well, we're gonna, and you know what? I have to say, you really eased me at that time. You said we're going to be cautious. It was very, it was perfect, and you've continued to keep that level of expertise, of weighing, urgency, and again, for the work I'm in with the people experiencing homelessness. And I say this all the time, we made that population such a priority because they were so vulnerable and so at risk. And you know how many emails you got from me and Fred. So, again, and as an organization that just this week, because we have state contracts, we're able to stop wearing masks at work. 3 years. 3 years. It was almost, I don't even know how to do it really. I don't even know how to go in the building and not do it. It almost becomes a part of you. But I want to thank you for your continued level-headedness, if that's a word. Is that a word? It behooves me to know the correct words, but I don't know them. But I cannot thank you enough. But I was just sitting here when you were talking, I remember we'd always say when it goes from pandemic to endemic, and which it will probably always be. But I really clearly, Nick, was it the first one? I can really remember that first meeting. And
Yeah,
then
I can give you the contents. Director Arroyo wasn't too happy with me
oh,
at the
well,
time.
I
But
find
that's
that
okay. I mean,
so hard to believe, but
yeah, I mean, well, it's because like it was just a couple cases in Seattle,
yeah,
and I wanted to bring it up as an agenda item, and she entertained my
and
thought
it
process.
became our lives. But I
Became our
again, I
lives.
thank you so much. Thank you, Mr. Chair.
And just a note, I was like looking at my Facebook messages. Today is the 3rd anniversary of when the city held its meeting with all of the providers.
Yeah.
So, and it was a week before we had our first case. We got our first case a week later. So again, this is when it all was starting for us, right? Like we had been talking about it and preparing for it and updating plans, but this was the day that we really kicked off. March 6th was the day of 2020 that we really kicked off our planning for the city. And, little did we know a week later, we'd be putting that plan into action.
Right. We shut down, and I just remember like not even having my voicemail set up, and the pandemic was coming. Wow. Majority Leader Clark, any questions, comments?
No, Mr. Chair. I try not to relive those days of COVID. So I'm ready. I'm ready to get past this thing.
Yeah, ready for the endemic. So just one question. In terms of Director Arroyo, you have all these major initiatives, but oftentimes the relationship or the service delivery systems where we're actually engaging community members and residents, are staff communicating with the community about the potential coming up, like for example, the recertification process regarding SNAP benefits, vaccines, the uninsured piece? Like, how has that communication been with the community?
So a lot of around SNAP, that's coming directly from DSS. Beneficiaries, my understanding, have been notified. We don't do SNAP at our office, so it's harder for us to access that information, although we know that a lot of our families are obviously SNAP eligible. In terms of moving forward, we're looking at doing a push in April around this. We considered doing a push around ordering home tests prior to that, but there's a shelf life on home tests, and so waiting a little bit later in the process could be better, right? So for instance, probably at the beginning of May, I'll go and get a supply using my insurance for my family and have some constancy that at least that supply will last me through the winter versus getting something that earlier and then it expiring by the time I actually may need it. So we're going to be pushing ordering on, and we have put out ordering online through the existing process with the Biden administration. We can get up to 4 free tests to your home. We'll also be putting out messaging as well to any individual with any insurance, Medicaid, private, or what it is, to be able to do that. And then again, we will roll out the PCR testing, and it is going to be Hartford residents only. I hate to do that, but limited resources, and other municipalities other health districts have also received funding from the state to be able to do some of this work. And we were really a big provider of vaccines to not only Hartford, but we had lots of folks come from Windsor and Bloomfield because we had people that looked like them and they felt comfortable with us. And so we're thinking through how we can continue to serve them in a low cost way moving forward as well, because they're integrated in our community. They come into work in our community, they shop in our community, so they're still a part of us. But we do, in terms of our resources, like we did with the vaccine when we initially did the rollout, we only did Hartford residents. Well, the first 2 weeks we didn't, then we put a stop to that, and then we only did Hartford residents until later in the rollout of the vaccines. I think it was not until after April, probably like May, is when we started vaccinating individuals from outside of the city again.
Right.
But those first 4.5 months, we really focused on city residents. And so we want to make sure that we're using our resources wisely and working to be able to provide the services that we can, prioritizing our residents first always.
So, yeah, so just a comment, you know, my other daytime hat is working with families who receive state benefits. And I know that we're relying on the state to, you know, communicate with the families. Far as I know, it's only been letters. The state system mailed home, snail mail, if you will. And they do have emails, but I mean, they're not landing. And so ever since the DSS changed its interface with its families that it's working with, where they've gone from case manager to more of a bank teller type, there's a better word for that. The relationships have been reduced. And so families are feeling not attached to the department. And so my fear is that the low-hanging fruit efforts that the state is taking, particularly communicating this to a marginalized community, and often disenfranchised community, is going to have a really negative effect. But you know, blessings to them all, and I just, you know, hope if there's any opportunity to communicate this, or maybe have some kind of communication plan to the city, or maybe partnering with the state. I don't know what that looks like. I just know that with my with the work that I do, we're informing people all the time and helping them with that, because there is still a lack of awareness. But with that being said, just one last question, Director. I know you got the babies, your children there. Just in terms of the budget season coming up, were there any adjustments in your budget requests in regards to this potential need to serve community residents, particularly in the areas of you know, testing and COVID things and things of that nature?
So on testing, no, just because we feel that with Medicaid being covered through the end of 2024, there's
Right.
some security there for a large part of our population, right? We do have, like, again, we have a lot of dual eligibles.
Mhm.
So there's that. And then with our own testing machines that we've purchased with state funds, we're actually in the process of redoing our contracts with that to see what we can use and have available. And we're also expanding that to include flu for residents. So we have that piece of the work that we think can be a stopgap measure on this. We are also on the vaccines. We decided to wait and see, because we're hearing very promising news that there's something in development at the federal government level. And so we're preparing ourselves to be able to enroll in that program, to be able to have the access for that. So the only thing for us is the coverage of the vaccines. And if that's covered, we can put the vaccines in arms. We have the capacity to do that with the current grants that we have. And then again, over time, as this becomes endemic, it was just recently added to the listing of recommended vaccines for adults. So once those things happen, then they start getting covered by insurance and other places. And then again, it's how can we ensure and work with our partners to cover those that are uninsured, and that'll be the biggest thing. And so we're still trying to dig our hands around that.
Mhm.
But again, we know that there's still a vaccine available. Could we purchase and stock it until this winter, and then only focus on an uninsured population? That's something we can consider doing as well.
Thank you.
And like I said, there's still grants out there
there's
that
still
we're
so much. Yeah.
There's still grants. The issue is always buying a vaccine, and it's hard to say, city, buy vaccine. It's going to be $130 a pop, because that's what they're talking about charging right now. It's really hard to put that on our municipality. and then to be able to manage that. It's only Hartford residents and all of that kind of crazy stuff. Like for us, it's been, we've not checked since last May who we're vaccinating, because we've had the ability with state funds to be able to do this. And we foresee that ability continuing, because we know that we have funds allocated through at least the middle of 2024, which we think will go beyond that. And we're in the process of applying for some additional funds right now through our REACH project. So you'll see a resolution for that as well, for applying and approving and accepting funds through that process. So we're looking at money for that, which would also cover administration, but it won't cover paying for the vaccine. So I think when we get to that, if it's not being covered in any other way by the feds or the state, then we would entertain another conversation about what do we want to do, how do we want to do that, how do we work with our community about that.
Yeah, I mean, a lot of it, Director, really, the municipalities bear the burden, and I'll just go on my soapbox and I end with this. It really was a miss on the federal level of holding pharma accountable. And I think from a policy standpoint at the federal level, it was just like, okay, let's just get this thing out there, but really not having the foresight to, cap, for example, what these things are going to cost or negotiate with pharma. It was just like, let's get it out there and not worry about the costs. And now the cost may very well cost us, if you will. But anyway, nonetheless, Director, thank you for that. And I appreciate your efforts. And your communication and your leadership as always. I believe that this committee holds you in such high esteem. I want to speak for all the members. So with that being said, seeing no more items and it being a long meeting, I'll take a motion to adjourn. Councilwoman Rossetti?
So moved.
All right, second. All right,
Second.
bye, everyone. Thank you,
Good night.
Councilman
Good
Clark.
evening.
Yes, all right. Have a wonderful evening, everyone.
Thank you. Bye.
Bye-bye.
All right, okay, bye.